Good morning. This is Babak, Larian, and I'm doing a Q&A session for parotid and salivary disease. I'm really happy to be here, to be able to help people, even remotely, especially during these times in the middle of a pandemic where access to healthcare is not so great. And I want to talk about a subject that's actually really important and hopefully helpful to some of you, especially in the middle of a pandemic, of course. And that's the subject of a parotid tumor, and what do we do at this point in time? What do we do in general, okay? It is tough right now to have a lump in the neck and try to address it and try to get healthcare, access to healthcare to get it done. So many thoughts running at the same time. Is it worthwhile for me to go to a healthcare environment, potentially expose myself to the coronavirus? Do I sit and wait? What do I do? And those are tough questions to answer, right? And very difficult to navigate at this point. Oftentimes I see patients who come with tumors in the parotid gland that have been told for years and years that this is nothing, it's just a lymph node or something to that effect. And fortunately, most parotid tumors are benign, roughly about 80%. Let me show you. So when you look here, in the parotid gland, most of the salivary gland tumors happen in the parotid gland. So 80% of salivary gland tumors happen in the parotid gland, and only 20% of those are cancerous. So in the parotid gland, odds are that a tumor is benign. 80% chance benign, 20% chance that it's cancerous. In the submandibular gland, now let me show you that. So the saliva glands are, this is the parotid gland. Let me actually do it in yellow. This is the parotid gland with a tumor in it, right? This is the submandibular gland. This is the sublingual gland. And then we have about 200 other tiny little glands on the back of the lip, on the roof of the mouth, and those little bubbles that you see, those little lumpy things on the back of your lip, those are all saliva glands. So these are the different categories of saliva glands: parotid gland, submandibular gland, sublingual gland, and the minor salivary glands, right? Which cover your whole mouth, floor of the mouth, back of the throat, back of the tongue, so on and so forth, right? So a chance of cancer in a parotid gland is only 20%. In the submandibular gland, when there's a tumor present, there's a 50% chance that it's a cancer. And in the minor glands, the sublingual and the minor glands in the mouth, when there's a tumor, there's a 70% chance that there's a cancer. So if you find a lump in your mouth, please get it seen. If you find something in your neck that's persisting, it's firm, right? That it starts as painless, especially if it starts as a painless lump in the neck, you definitely need to have it checked out, okay? That's really important. Find, maybe a primary doctor, but if you have access to ear, nose, and throat doctor so they can do a full assessment, most ear, nose, and throat doctors can do a needle biopsy in their office, right? All around the world. They can. So if they feel like this is something that warrants a biopsy, definitely. A lot of us ear, nose, and throat doctors have ultrasound machines in our office. We can do an ultrasound, do a needle biopsy right then and there, and figure out what's going on. So those need to be addressed. In terms of the parotid gland, if there's a mass in the parotid gland, right, and if two categories, right? If there's a mass that you just have found, right, in the middle of the pandemic, in the past 2 months you found the mass, it is not growing rapidly. It is softer and it moves, right? Then you have a little bit of time, right? If, on the other hand, the mass is in the parotid gland, is not soft, it's firm, it feels like a knuckle, right? It's a hard mass, or it doesn't move so well when you put it between two fingers. or if it's painful, or if you feel like one of the branches of your facial nerve is weak, meaning when you smile, your smile is crooked, right? Meaning one of the nerves are not functioning properly, then that really warrants that you go immediately and get that investigated, right? So that's important. An extension of that is people who have had tumors, masses in the parotid gland for a long time. Now, again, most tumors in the parotid gland are benign, but if left behind, some of these tumors can obviously grow, right? And let me show you what I mean by that. So, tumors in the parotid gland can start at many different sizes. It can be very small, like this one right there, and they can grow to be bigger and bigger, right? And most of the tumors in the salivary gland tend to have a growth pattern that ultimately grows to be very large. And so they do need to be addressed. Not all of them. Fortunately, not all of them, but most of them. And truthfully, the reasoning for someone to allow a tumor to get from this size to bigger sizes either has to do with not having access to healthcare, right, which unfortunately still happens in this world, or because of a fear that exists, right? Some of the patients that I have who've had this have had a family member have a parotid tumor, have surgery, and have a paralyzed face. Of course they'll be fearful. People have a fear of being diagnosed with a cancer, so they push away as if by not getting a needle biopsy and not getting the diagnosis, the cancer may go away. It may seem like an unreasonable fear, and it is an unreasonable fear, but it is a fear, and people have to live with the fears they have. Nonetheless, the reason I'm talking about it is because just this past week, I had to do surgery on a person who, I don't have the picture here, who had a tumor somewhere between these two sizes, right? And had been there, this tumor had been there for years and years. And she had a family member who passed away from a cancer and from treatment for cancer, right? That's the fear. And because the family member had passed away in getting treated for cancer, she thought, well, I'm not going to go through that, right? I'm not gonna let the doctors do that to me. And so she was trying all sorts of remedies, right? Because she was afraid of chemotherapy and radiation. She was trying all sorts of remedies. And the problem with that is that parotid tumors, although mostly benign, there are some, in fact, the most common type of tumor called pleomorphic adenoma has a genetic base to it that is precancerous. So what do I mean by that? In order for us to get a cancer, let's say on the tongue, right? We know that people usually need 8 mutations to occur in the same cell in order to get a cancer, for that cell that was benign to turn into a cancer that grows without limit and can spread to other parts of the body, right? And so someone who smokes a lot and exposes that cell to constant exposure to carcinogens from smoking has the possibility to transform that into a cancer, because more mutations can accumulate in the same cell and ultimately it can turn into a cancer, right? Pleomorphic adenomas have several genetic mutations, right? So let's say, again, in the parotid, we need 8 mutations to get a cancer, right? So 8 errors in the DNA code, right? So all of our body has the same DNA code, but if there's errors in it, those errors can either kill the cell or allow the cell to have a lack of inhibition, right? So that cell is no longer inhibited from growing, can grow. In any case, so if you have a pleomorphic adenoma that has, let's say, 3 or 4 of those mutations that are in line with the 8 that you need to become cancer, then as you get exposed to more toxins in the environment, the smog, the hormones, the preservatives in the food we eat, the toxins in the water, all the exposures that we have, then potentially those mutations can occur, right? Now, when you have a tumor that is small, a tumor is that big, let's say 2 millimeters in size, right? So this tumor here, that is this small, when you have a tumor that small, 2 millimeters, that's 1 million cells. So if you have 1 million pleomorphic adenoma cells that have 3 or 4 mutations already in line with, and they keep getting exposed, so all of those 1 million cells are getting exposed to the toxins. So the chances of getting mutations increases. And as the size of the tumor increases and there are more cells to get exposure, the more chances, the more cells exposed to the toxins in the environment that allow the potential for change. So pleomorphic adenoma is actually a very dangerous tumor because it can in time turn into a cancer. Fortunately, it's not a certainty. Not every patient get transforms, but some do. And so allowing a tumor to grow inside a parotid gland, right, has a lot of problems with it. And that's the issue, you know? So letting a tumor grow in the parotid gland is a huge problem. And that's what this poor lady had. And of course she was fearful and she was trying all sorts of natural remedies, which actually I'm for. I feel like if you're addressing a tumor, you got to do everything you can to try to improve it, you know? I've had patients see healers. I've had patients do all sorts of therapies, right? But I would say do that in concert with a treatment that you know is going to work. So a pleomorphic adenoma can very well be treated with a surgical procedure that has minimal risk in the hands of an expert surgeon. So your job, if you have a tumor, is find someone who has expertise in taking it out. And once you do, then you can have a relatively, I can't say simple, but a relatively successful procedure. By that I mean, in the hands of an expert parotid surgeon, you can have a parotid tumor removed with probably more than a 99% chance that the tumor is removed whole, as well as not injuring the facial nerve, right? And that 100% depends on the expertise of the surgeon. So your job is to find an expert to do the surgery for you. And then you will have a successful surgery. You're gonna have someone who's gonna do the surgery. Who's an expert surgeon? Well, reputation obviously matters, but also how many parotid surgeries they do a year. If they do 5 or 10, that are not gonna have as much expertise. But if they're doing 30, 40, 50 a year, then obviously they'll have more expertise. And that's your responsibility, to find that person that's gonna be able to give you that much confidence and that much expertise, right? And so, you know, allowing a tumor to grow, the larger the tumor gets, the more entangled it gets with the facial nerve, the more problems that person is gonna have in removing that tumor for you, right? Having said that, we removed a massive tumor, right, that had unfortunately transformed into a cancer, right? And even though it had transformed into a cancer, right, we were able to do scans to make sure it hasn't spread to other parts of the body. We were able to remove the whole tumor and maintain the integrity of the most of the facial nerve, right? And we had one minor branch have tumor wrapped around it, which we couldn't save. But the person was able to smile, they were able to close their eyes, they had full movement of the brow, they were able to show their expressions and be able to communicate effectively, right? And have symmetry on their face. You know, so that's really important. Now I'll get pictures of this person to show it, you know, because it's really educational to see that, to see what's possible despite a larger tumor, so that it allays a lot of the fear people have. But what I'm trying to urge is that please address it. Don't push it aside and try to get rid of it. You know, and hope that it's going to go away, because they just don't. They don't relent. You know, I've had tumors shrink because of natural remedies. I unfortunately haven't had tumors go away. I wish they would with natural remedies, right? In any case, so that's the one thing I want to talk about. The next thing is a lot of concern. People have a lot of concern about the facial nerve, right? So let's talk about the facial nerve. The facial nerve comes out of this first. Actually, the facial nerve in the brain does two turns, comes in the bones of the skull, right, and exits through a hole in the skull, comes out and enters the parotid gland. In the parotid gland, immediately after it enters, it divides into two branches. The lower branch goes to the muscles of the neck and the lower lip. The upper branch goes to the muscle of smiling, upper lip movement, eye movement, and also eyebrow, right? So this is called the lower division, and this is called the upper division. The upper division has most of the functionality. It helps with the smile, eye movement, brow movement. Most of the important expressions that we have are related to the functionality of the upper division, right? So this is a very important nerve branch. Lower division is obviously important. All branches are important, right? So you do everything you can to protect them. Now, when a tumor develops, the location of the tumor matters. So if you have a tumor in the tail of the parotid here, right in the posterior aspect of the tail of the parotid, it's less likely to be close to a nerve branch, right? But if the tumor is in the middle here, right, over the jaw, right? So this is the jaw bone, and then it comes up like this, right? And then that's the joint of the jaw. Right, that's the jawbone, right? So if the tumor is over the jawbone here, then it's more likely to be close to a nerve branch, the upper division branch. If the tumor is in the lower part here, most likely to be close to the lower division. If the tumor is right here at the base, it can be close to the nerve. Now, the reason I say it can be is if we were to look at the parotid gland here, this is 1 versus 2. The parotid gland in position 1 looks like this in cross-section, right? This is what it looks like here, all right? So this is the jawbone would be in front of it, right? And the ear bone would be behind it, right? And the facial nerve is in the deeper portion, right? So if you have a tumor in this area there, that tumor can potentially be superficial and not close to the nerve, but as it gets bigger and bigger and bigger, it's gonna at some point get to the nerve. Now sometimes the tumors develop below the nerve, right? But those tumors are not usually visible on the outside. Those tumors are usually found incidentally when someone has a headache and they do an MRI of the brain to see the brain, and they find it incidentally, right? In any case, so as you let the tumor grow, it can get close to the nerve. Now in position 2, because the tumor is over the parotid gland, over the jawbone in the parotid gland flattens out. And at this point, it's sitting over the jawbone, right? And so at this position, there's 1, 2, 3, 4 branches, right? So you're gonna have 1, 2, 3, 4. And so the tumors here can be sitting right over a branch, in between a branch, underneath a branch. That could be anywhere. But most likely, even a small tumor is gonna be close to a nerve branch. Now, that seems problematic, which it is. And I'd say probably 90% of the tumors that I remove, maybe even more, are sitting on a nerve branch. Probably 95%, right? They're sitting on a branch of the facial nerve. And again, that's where the skill of your surgeon comes in, to be gentle with the nerve branches. As we dissect and remove the tumor off the nerve branch, being gentle with the nerve. So, the literature reports anywhere between 3 to 7% chance of temporary weakness. when we do it, because we're so gentle and we do this so often, the temporary weakness percentage is significantly lower. It's 1 to 2%. And it's purely because we take our time. Your surgeon needs to be patient, needs to be concise, precise, and take his or her time when they're doing the surgery so that they are gentle with the nerve, so you're not left with a branch weakness, temporary weakness even, and paralysis. Again, expert surgeon really can avoid causing permanent paralysis in a majority of cases. All right, and so, of course, the facial nerve is the most important concern, right along with the removal of the tumor successfully in doing a parotid surgery. But the surgery can be done very well, even if the tumor is underneath the nerve, even if the tumor is underneath several branches of the nerve, which I'd say probably most of the time there is several branches that are next to the tumors that I'm removing. But that can be a very successful surgery as long as it's done with patience and consideration and delicacy, a delicate touch. That's the important thing, right? So if you have questions, if you have concerns, please see your doctor. Even during this time, if you have a mass in your parotid gland, in your neck, all right, and you're concerned, it's better to see your doctor and address it sooner rather than later, okay? Because it can be unexpected. I just was doing a little biopsy of a young man, 30-some-year-old man who had a lump in his neck for 2 months. And he had a skin cyst just immediately behind that area and thought this was a lymph node that reacted to that cyst, and came to me, and I thought the nodule looks the lymph node looks a little suspicious on ultrasound. I took it out, I biopsied it, and unfortunately it was a melanoma. So that cyst on the skin was actually not a cyst, it was actually a melanoma, right? So things can be surprising. They can look different than expected. And the melanoma did not have a pigment on it. It was actually pink. It wasn't a brown or dark colored, ugly mass. It was actually kind of a benign looking mass, So please be cautious. If you have a lump in your neck, please see an ear, nose, and throat doctor so you can address it quickly, because most things can be cured. Most things can be dealt with. The sooner they're dealt with, the better the outcomes are. All right? Well, I hope you have a wonderful day. I hope you guys stay healthy. I hope your families stay healthy. I hope the information that's coming to you makes sense and is helpful to you, because there's a lot of information out there about COVID and Corona that's confusing even to us physicians. So be smart, be cautious. Verify every bit of information you get before you act on it, and best of luck to you. And if I can be of any help, don't hesitate to contact me. All the best. Bye.